Hello, I'm wondering, are you thinking about stopping tamoxifen? In this video, I'm going to be talking about tamoxifen, what it is and why we use it, why people might want to stop it, and maybe this will sound familiar to you, and what to do if you're thinking about stopping tamoxifen. Before I go on, I want to invite you to subscribe to our channel. We're always putting out new content, so there's new stuff to watch, and if you have an idea for a video, just drop it in the comments below. So tamoxifen is used in the treatment and prevention of hormone receptor-positive breast cancer. If you've had breast cancer and your tumor had the estrogen receptor and or progesterone receptor on it, and we'll link to a video about those, it's very likely that endocrine therapy of some sort will be recommended to you. Tamoxifen is used in people who are premenopausal, who still have functioning ovaries, and it can be used in people who've already gone through menopause or who don't have ovaries. So tamoxifen is one of our oldest anti-cancer therapies. It's been around for over 50 years. We are not surprised anymore with new side effects, but the side effects it does cause can be really troublesome. And those include, and this is not a complete list, hot flashes, night sweats, joint pains, vaginal dryness, sexual problems, all sorts of things, skin dryness, occasionally hair thinning. And again, that's not all the side effects, but just that list alone, you're probably pretty convinced that stopping is something pretty common. And in fact, studies have shown that up to 50%, that's up to half of people, either stop tamoxifen early before their full course of 5 or 10 years, or seriously consider stopping. So these side effects are really troublesome. Don't let anybody tell you that they're mild. Now, it's important to know that we can make some tweaks, some adjustments to tamoxifen therapy, and that you may also be offered an alternative to tamoxifen. So I'm not going to go a lot into those because the focus is on stopping tamoxifen, but it's important to keep an open dialogue with your medical team. I do want to invite you to go to Yerbba.com to get your personalized report, because your Yerbba report will take your medical records after you give us permission and automatically download and create a report showing you all the options you might have, the pros and cons of each, what to expect, questions you can ask your doctor to prepare for your visits, and it's updated. So if you change medication, your Yerbba report is updated. So tamoxifen is a really effective drug, but the benefit in your case may be lower than in somebody else's case. What do I mean by that? If you had high-risk breast cancer, stages 2 or 3, or you have stage 4 breast cancer, you are more likely to benefit from tamoxifen than somebody with non-invasive breast cancer or somebody with a low-risk stage 1 breast cancer. Why is that? Well, in higher risk disease, there are more people who are going to have a recurrence, and the benefit of tamoxifen, which is cutting that risk in almost half, will be much greater if there's a greater risk. So the absolute benefit is greater if you have a higher risk of recurrence. If you are on tamoxifen because you have a high risk of developing breast cancer, but you don't have breast cancer, or because you have a lower risk breast cancer, the benefit is lower because your risk of the cancer coming back is lower. So if you have never had breast cancer and you're on it to reduce your risk, or you have DCIS, non-invasive, or sometimes it's called stage 0 breast cancer, there really is no survival benefit to you. You're on it to decrease the risk of getting a cancer in the breast that had breast cancer, DCIS, and it can decrease the risk slightly in the other breast. So there's no life-saving benefit in people who haven't ever had breast cancer, where we're giving it to reduce the risk, or people with non-invasive breast cancer. It just reduces the risk of cancer in the breast. So lots of people think that they have to stay on it because it's saving their life, but really it's a risk reduction or quality improvement benefit. If you feel miserable on tamoxifen, then it's taking away your quality of life. So this is time to have a really clear discussion with your medical team, those people prescribing tamoxifen, and say, what exactly is the benefit? And since it's really a quality of life benefit, I'd like to stop the medication or try coming off of it for a little bit or consider alternatives. If you have higher risk disease, tamoxifen is an important part of your treatment. It's very likely that you're also on something that will reduce your risk of it's also likely that you're on something to suppress your ovaries, like an injection, or you had your ovaries out, both of which can cause the same side effects. So it's important to tease out what exactly is causing my side effects. If you're only on tamoxifen and you're having side effects and you had stage 2 or stage 3 disease, your doctors and other people on your medical team are going to encourage you to stay on some form of endocrine therapy. In that case, it's really important to let them know the side effects that you're having. You know, a lot of times patients want to downplay their side effects. They don't want to be a bad patient. You're not a bad patient. You're giving high quality information to your medical team. Just like we want to give you high quality information, you're telling us that you're having these side effects. And more important, and maybe more useful than I'm having hot flashes, or I'm having joint pains, or I'm having sexual side effects, is to talk about the impact of these symptoms on your life. So, for example, if you are having hot flashes, say, I'm just going to make up a couple examples here. I can't sleep at night because of my hot flashes. I am waking up 5 or 6 times because of my hot flashes. Or I can't give a presentation in a meeting without having a hot flash. This is decreasing my confidence as a leader in my organization. Or if you're having sexual side effects, my partner and I used to have a great sex life, and now we haven't had sex in 1 or 2 months. Just, you have to lay out the picture so that your medical team can see the severity. And if it's not severe, you can say, I'm having hot flashes, they affect my sleep once or twice a week, and I'd like to stay on it. What other things can we do? I'm hoping that this is making sense. Plan ahead before your conversation. Think of a couple really good examples. You can ask your friends and family, what are you noticing now that I'm on tamoxifen? Give a couple examples so that your medical team knows the impact the side effects are having on your life. It paints a picture, and pictures are so much more powerful than just saying, yes, no, I'm having them, or even they're mild, moderate, or severe. Let us know the impact it's having on your life. There are things we can do. There are medications we can use to manage side effects. I have to tell you, a lot of physicians and a lot of patients don't like the idea of being on another medication to treat the side effects of another medication. It just increases the burden of pills that you're taking, and of course, nearly everything has side effects. So yes, if your hot flashes are so severe that you are miserable, it might make sense to go on a medication to help with hot flashes. It might make sense to go on a medication to help with joint pains. But we try to do lifestyle things first. So quitting smoking can help with hot flashes. Watching your caffeine, watching spicy food, cutting out alcohol, those things can help hot flashes, and maybe you can stay on tamoxifen without being on another medication. We have a lot of videos in our library about managing the different side effects of endocrine therapy, tamoxifen, and the aromatase inhibitors. And I would encourage you to search on our channel for specific side effects of endocrine therapy, because we do have a lot of tips. And I don't have time in this video to go into everything. What I really wanted to do was make the point that the benefit of the drug is not the same in everybody, and understanding that benefit can be really helpful. And then also give you some tips on talking with your medical team. You are not complaining, you are reporting side effects. Finally, in people at lower risk of recurrence, there is some evidence that even a smaller dose of tamoxifen, so the standard dose is 20 milligrams a day, but 5 milligrams a day has been shown in people at low risk of recurrence to be safe and effective, the same as 20 milligrams with fewer side effects. So this is why having a dialogue with your medical team makes a lot of sense, because there are alternatives. So let's say you had DCIS and you want to stay on something, you don't feel good on tamoxifen, lowering the dose to 5 milligrams is a consideration for you. I've covered a lot in this video. My guess is that you have additional questions or you have something that's worked for you. I would encourage you to share that with others. And before I leave, I do want to invite you to go to yerbba.com to get your personalized report. Thanks for watching, and we'll see you next time.